I'm Dr. Gerald Chodak. In this video, I want to discuss with you the stage of prostate cancer. The stage means where is the cancer located? Is it confined inside the prostate, or has it spread to other parts of the body? Prostate cancer can spread most commonly into the bones or into the lymph nodes. And we have staging systems available to try and tell you or characterize where your cancer is located. The reason this is important is because the stage of your cancer will have a great influence on the most appropriate treatments available to you. By that I mean, if the cancer is localized in the prostate, we would offer one form of treatment. On the other hand, if it is unfortunately spread to other parts of the body, we're not going to do those treatments for local disease. We're going to offer you different treatments. So how can we characterize stage? Well, there's a couple of systems available. The best system that's currently in use is called the TNM system. TNM stands for tumor, lymph nodes, and metastases. The T, or tumor stage, tells us where is the cancer located in the prostate. Is it completely inside the prostate? Is it growing through the wall? Is it spreading outside into the capsule or into the surrounding tissue? And you will see popping up in our pop-up window some information, some pictures, and references where you can also go look and seek out more information about the stage. But very simply, we have the following. Stage T1 means it's localized in the prostate and we can't feel it when we do a physical exam, a prostate exam. There are no lumps or bumps. We call that stage T1. Stage T2 means we actually feel a lump, a suspicion of cancer located either in one side or both sides of the prostate. But stage T2 still seems to be localized. We don't think it's growing outside of the prostate wall. Stage T3 means, in fact, it is growing outside the capsule. It can be in the surrounding capsule, surrounding the prostate, or it may actually be growing into the seminal vesicles. Those are organs that are attached to the prostate. Cancer can spread there as well. We call those stage T3. T4 means that it's growing into the muscle wall, or it's growing into the rectum, or it's growing into the bladder. So it's all about the local area of the cancer. That's the T stage. The N stage is the status of your lymph nodes. We characterize them as N positive or N negative, meaning that there's cancer in the lymph nodes or there's no cancer in the lymph nodes. Unfortunately, we can't tell whether it's really in the lymph nodes unless we take out your lymph nodes, which is done in some cases. But otherwise, we have to rely on very inaccurate tests such as a CAT scan. So most patients who simply have a physical exam, they'll be told that the status of their lymph nodes is what we call NX, meaning we just don't know for sure. NX means we don't know, and positive means the lymph nodes are involved with cancer, and 0 means there's no cancer in the lymph nodes. Lastly, we talk about the M stage. Is it metastasized or not? If there's cancer in the bones or other organs, we call that M positive. If there's no evidence of cancer in other organs, we call that M0. And if we're really not sure because we haven't done any other tests, then we call that MX. So we have a T stage, an N stage, and an M stage for every patient. That information will be part of the information used to plan your overall therapy. That will be discussed in another video. Thank you.